How to get rid of vaginal yeast infection, how to treat vaginal yeast infection, things to avoid if you have vaginal yeast infection, and how to prevent this yeast infection. I've been treating vaginal yeast infection for so long, but it seems the drugs are not working for me. It seems like the drugs are ineffective. Sometimes it goes and comes back. Maybe I'm not doing the right thing. Maybe I'm not doing the rightful thing. In the aspect of using or taking antibiotics to treat yeast infection is a hell no. It will do you no good than harm. Antibiotics will only decrease the level of healthy bacteria and increase yeast infection. It can also be that you have a less common species of yeast that doesn't respond to the standard medication, that doesn't respond to the medication that you are taking. And it can also be another thing. It can be another thing that you never think of. It can be another thing that you mistaken to be a yeast infection like bacterial vaginitis, which also appear like yeast infection and also causes itching, discomfort, and discharge. So you mistaken it to be a yeast infection, and this is also a reason why self-diagnosis is not a good option. Self-diagnosis is not advisable. You should also know that high level of estrogen causes the yeast to overgrow. In other words, it is common to have yeast infection around the time of your menstrual period, around the time of your period in a month. And don't also forget that wearing menstrual pad for so long, wearing menstrual pad for so long without changing it can create a condition. It can create a condition that promotes the yeast to overgrow. What are those things to avoid if you have yeast infection? The things to avoid if you have yeast infection. Number one thing to avoid is antibiotics. Avoid antibiotics. Like I said before, antibiotics will only decrease the level of healthy bacteria and increase yeast infection. Antibiotics works for bacteria that causes infection. It works for bacterial infections. So it doesn't work for yeast infection. It works for only bacterial infection and can also keep beneficial bacteria in other parts of the body, including the vagina. So avoid antibiotics. Number two thing to avoid is scratching. Avoid scratching. Do not scratch. Scratching can cause the skin to crack, and in such case, you'll be more exposed. You'll be more likely to have skin infection. Number three thing to avoid is douches wash. If you have vaginal yeast infection, avoid douches wash. Douches wash will only increase irritation than help treat your infection. Douches wash is the practice of cleansing or washing the inside of the vagina with liquid mixture or solution. So if you have yeast infection, avoid douches wash. The fourth one to avoid is tight and nylon underwears. Avoid tight and nylon underwears. Instead, go for cotton wears to help absorb excess moisture. Now, how to get rid of this yeast infection that you've been treating, and it keeps coming back? How to get rid of it? Number one is by keeping to those things that I mentioned. Keeping to those things that I mentioned, by avoiding those things that I mentioned, avoid those things. And when it comes to antibiotics, stop abusing antibiotics even after the treatment of this yeast infection. Avoid abusing antibiotics and other drugs also. Then the number two is by maintaining personal hygiene. Very important. You need to maintain personal hygiene. You need to be hygienic. And then the number three is by antifungal drugs, by taking antifungal drugs, okay, which also comes for oral. It comes in oral, and it also comes for the vaginal inserts, okay. So we are going for the antifungal, the oral, we're going for the fluconazole. Yes, we're going to fluconazole. So you buy fluconazole, and the fluconazole is the diflucan by brand name. You buy diflucan fluconazole, okay. So you're buying that, is by Pfizer. So you buy it, and you are to be taking 150 milligram. Yes, you take 150 milligram in a day. Yes, every day for 3 to 5 days. It depends on how severe the infection is. It depends on how severe this yeast infection is. So you're going to take 150 milligram in a day, and this a day. If you're taking it in the night, then it should be every night. If you're taking it in the morning, it should be in every morning, that same time, every 24 hours. Then the second thing we will be needing is polygynous or gynocare. So if you're buying polygynous, you will leave the gynocare. If you're buying the gynocare, then you will leave the polygynous. So you're buying only one out of the two. Okay, they contain the same thing, they are the same composition, so you're getting only one of it. Okay, and then this polygynous or gynocare is a good option. Seriously, is a good option. Okay, it doesn't work for only candidiasis. It doesn't work for only candidiasis. It works for other things. It works for both bacterial vaginitis because it has a pneumycin. Yes, it contains pneumycin, so it works for both bacterial vaginitis. It works for any gynecological ailment, okay. So if you get it, you're not going to regret it. You will achieve your okay. So you are going to insert one every night, okay, every 24 hours. In the night, if it's by 8 you're going to bed, then it's every 8 o'clock in the night. Okay, so you insert one every night. Okay, and that should be after you're done with your house chores, you're done with everything that you're doing in the house, and you're about going to bed, then you insult it. Okay, and that is it. And trust me, if you can afford it, it's a little bit expensive but not that much expensive. If you can afford it, trust me, you're going to achieve it. You're going to achieve your goal. Okay, I wish you good luck.